Hi guys, it's Dr. Saman. I want to talk to you a little bit about the first week after rhinoplasty. So you've had your surgery done, what's going to happen from that point until a week later when you come in to have the splint removed. So after the surgery, you'll be admitted to the recovery area. That's where you wake up a little bit, you see the nurses taking care of you. You'll have a dressing over your upper lip called the mustache dressing, and that's to capture any drainage that might come from the nose, any blood that might come from the nose. That I expect for the first 48 to 72 hours. We'll give you some gauze to take home, and you can change that as needed. You'll be then from there be discharged to a responsible adult that's with you. That has to be your companion. We can't discharge you to the taxi driver or an Uber driver. We need a responsible adult to stay with you the first night. This is especially important for our out-of-town patients. We would have to set up a nursing service, or you need to come in with a family member. Once you get home, you probably have some anesthesia on board. You probably feel tired. Rest up, it's okay. Just relax, let your body recover, and get rid of the anesthesia that's on board. You may be nauseous, you may even throw up. If you throw up, you might notice that you have a little bit of blood in your stomach. Don't worry about it. That's just blood you've swallowed during the procedure, although I try to empty out the stomach completely right after the procedure. If you feel nausea still after that, so take the Zofran that we've prescribed to you and try to not take the narcotic that's in the pain medication if you don't have to. My patients generally don't experience a ton of discomfort. Generally, Tylenol or a combination with Advil, staggered, works better than Tramadol or Tylenol with codeine in general anyway. And it causes less nausea, and we don't have to worry about dependence either. So the next day, you wake up, you'll have swelling. There'll be some swelling around the eyes, around the cheeks. It's okay. You can ice those areas. Don't ice the nose. Ice underneath the eyes and the cheeks. Ice over the forehead. Put the head of the bed up a little bit for increased drainage, and that should help. Regardless, this swelling will be with you for the first 72 hours, even up to 96 hours. Generally, by the time you come see me at 1 week, it's mostly gone. In terms of cleaning, depending on the approach I've taken, you might have sutures here. If I've done anything to the nostrils, you might have sutures there. Clean gently with a Q-tip and a hydrogen peroxide, just gently. If it's a lot of crusting and you can't get it off, just leave it alone. I don't want you to pop the sutures. Keep the incision lines moist with some sort of ointment consistency. I don't care so much about what's in the ointment. I care more about the consistency. So it could be Aquaphor, Vaseline, Neosporin, bacitracin, but always should be moist. You can start applying saline spray inside the nose day 4. If you feel like the saline spray cannot get all the way back and you're not able to get it to the back of your throat, don't worry about it. Just allow it to come out over the sink, and that's okay. I see you day 7 generally. That's when I remove the sutures. Make sure you come in with your stomach not empty. So your blood sugar doesn't drop. We'll make you comfortable. We'll remove the sutures, remove the splints. I'll teach you how to tape. At that time, I'll give you all the post-op instructions. I think I've covered most things, most of the questions that come in for the first week. If there are things that you think might come up that I haven't addressed, leave a comment in the comment section. If you've already had a rhinoplasty and you encountered other issues that I didn't address in this talk, leave it in the comment section. I'll review those a little later, and I'll make sure I leave the answer to those later. I wish you a very smooth journey in your operation and in post-op recovery, and I'll see you after.